Hi, welcome to our channel of IGNOU audiobooks, Indira Gandhi National Open University, School of Health Sciences, SOHS, Certificate Programs, Certificate in Newborn and Infant Nursing, CNIN, BNS 115 Nursing Care of Newborn and Infant, Block-1 Preventive and Promotional Aspects of Newborn, Unit-4 Prevention of Infection in Newborn Unit 4.0 Objectives. After reading this unit, you should be able to times list the sources of infection and the tips for its reduction in newborn unit times. Enlist the infection prevention practices after birth times. Enumerate the basic requirements for asepsis in newborn unit times. Describe the guidelines to be followed for asepsis in newborn unit times. Discuss the various types of disinfectants germicides used in newborn unit times. Explain waste management and times. Discuss post-exposure prophylaxis surveillance. 4.1 Introduction. After understanding the importance and setup of newborn care unit, the nurse must be able to maintain the unit properly and prevent infection. This unit describes prevention of infection in newborn care unit. Neonatal infections have been the major cause of neonatal deaths in our country. Newborn babies are more susceptible to infections because their immune system is immature. Normally, the newborn is free from harmful organisms initially up to few hours after birth. Health personnel working in the hospitals tend to transmit organisms during routine procedures, which leads to infection in newborns. Hence, it is important to know the infection control measures to promote health and minimize infections to the newborns. Prevention of infection is more cost-effective than treating infections in neonates. 4.2 Definition of terms. 1. Asepsis. Asepsis is combination of efforts made to prevent the entry of microorganisms into an area of body where they are likely to cause infection. 2. Cleaning. Cleaning is the process that physically removes all visible blood, body fluids, or any other material, for example dust or soil, from skin or inanimate objects. 3. Disinfection. Disinfection is the process that eliminates most but not all disease-causing microorganisms from inanimate objects. 4. Sterilization. Sterilization is the freeing of an article from all living organisms, including viable spores. In other words, it is the destruction of all forms of microbial life. It is accomplished by physical and chemical processes, for example, steam under pressure, dry heat, ethylene oxide, hydrogen peroxide gas, liquid, chemicals, etc. 4.3 General principles of infection prevention. By practicing infection prevention measures, the baby, mother, and care provider can be protected from infections. The spread of infection can also be prevented by means of the following times. Provide routine care to the newborn baby times. Consider every person, including the baby and staff, as potentially infectious times. Wash hands or use an alcohol-based hand rub times. Wear protective clothing and gloves times. Use antiseptic technique times. Handle sharp instruments carefully and clean them. If necessary, sterilize or disinfect instruments and equipment times. Routinely clean the newborn special care unit and dispose of waste times. Isolate babies with infections to prevent nosocomial infections. 4.4 Source of infection in newborn unit. The source of infection in newborn unit could be any of the following times. Personnel working in the unit times. Infected newborns times. Fomites equipment times. Environment times. Invasive procedures. Tips for reduction of sources of infection times. Newborn care unit should be located in a low-traffic area with restricted access times. It is to be ensured that babies receive immunizations such as rubella, measles, hepatitis B virus, mumps, and influenza times. Persons with skin infections should not be allowed to come into direct contact with babies. Care providers in direct contact to be avoided to be minimal times. Persons with acute infections should not be allowed to enter the newborn unit times. Number of individuals handling the baby should be limited. Nosocomial infection Nosocomial infections are infections that are acquired in the healthcare facility. If nosocomial infection occurs, strict control measures should be put in place and monitored to resolve the problem. Measures to control nosocomial infections are as follows. 1. Isolate the baby by placing the baby and his mother in a private room. 2. Leave the door open, if necessary, to ensure that the baby and mother are not neglected. 3. If a private room is not available, place all babies with the same infection in one room, but no other baby with a different infection should be placed in the same room. 4. When entering the room with the baby, times wear clean examination gloves and change gloves after contact with infectious material, e.g., fecal material, gauze used to wash pustules or blisters. Times wear a clean gown if contact with the baby or infectious material is anticipated. 5. Before leaving the room, times remove the gown. Times remove gloves. Times wash hands with an antibacterial soap or alcohol-based hand rub. Times avoid touching potentially contaminated surfaces or objects and ensure that clothing does not come in contact with potentially contaminated surfaces or objects. Times restrict transfer of baby to other areas of the healthcare facility unless absolutely necessary. During transfer, maintain infection prevention precautions. Times reserve non-critical care equipment, e.g., stethoscope, thermometer, for use only with the infected baby, if possible, and carefully clean and disinfect equipment shared among infected and non-infected babies. 4.5 Infection prevention practices after birth. Cleanliness at delivery and essential newborn care reduces the risk of infection for the mother and the baby, especially neonatal sepsis and tetanus. Breastfeeding has a significant protective effect against infections. The following are the practices of infection prevention after birth. Times routine care of the newborn baby should be given. Times 6 hours after birth or after the baby's temperature is stable, the baby's skin should be cleaned with cotton cloth soaked in warm water to remove blood or other body fluids and then dried. Delay bathing until at least the second day of life. Times the buttocks and perineal area of the baby should be cleaned each time the baby's napkin is changed or as often as required. Using cotton soaked in warm, soapy water and the area has to be dried. Times ensure that the mother knows correct positioning and attachment for breast feeding to prevent mastitis and nipple damage. Remember, hand washing is the single most important behavior to emphasize for both family members and healthcare providers. 4.6 Basic requirements and guidelines for asepsis in a newborn care unit. 4.6.1 Basic requirements for asepsis. The following are the basic requirements for asepsis in a newborn care unit. Times running water supply, times strict hand washing, times promotion of breast milk feeding, times avoiding overcrowding, times adequate disposables, times rational admission policy, times rational antibiotic policy, times good housekeeping and asepsis. Other basics are as follows. Times keep separate spirit and betadine swab containers, stethoscope, tape measure, and thermometer for each baby. Times change intravenous sets daily or as per set routine. Times feeding tubes as long as baby can keep. Times do not keep fomites, for example files, X-ray films, pens etc. on the baby cot. Times change antiseptic solution in suction bottles and sterile water in oxygen, humidification chambers every day. Times sterilize the bottles chambers daily by dipping in 2% glutaraldehyde for 4 to 6 hours. 4.6.2 Guidelines to be followed in newborn unit. A. Entry. There should be a strict restriction to enter into the newborn unit. Only healthcare providers, doctors, nursing staff, and parents should be allowed. No visitors or attendants should be allowed to enter into the newborn unit. B. Footwear, shoes, socks and woolens should be removed and nursery slippers should be worn before entering the newborn unit. Changes of slippers, though, do not help in controlling of infection, but it does prevent unwanted entries. C. Hand washing. It is very simple, cheap, and the single most important step of preventing nosocomial infections in newborn unit. Hands and arms should be thoroughly washed up to elbows with soap and water for at least 2 minutes before entering the newborn unit, and for 15 seconds in between handling the babies. Tips for hand washing. 1. Prior to hand washing, rings, bangles, threads, and all the accessories worn over the forearm and hands should be removed. 2. Using plain water and soap, hands must be thoroughly washed up to the elbow for at least 2 minutes in the following sequence: times palms and fingers and web spaces, times back of hands, times finger and knuckles, times thumbs, times fingertips, times wrists and forearm up to the elbow. Refer Fig. 4.1 for steps of hand washing. 3. A plain, antimicrobial soap is recommended in any convenient form: bar, leaflets, liquid and powder. 4. Hands must be washed for at least 30 seconds before touching next baby, after handling an infected neonate. If the baby is uninfected, alcohol-based hand rubs, sterilium or 70% alcohol, can be used as a substitute for hand washing before touching another newborn. 5. Rinsing hands with sterilium or alcohol is not a substitute for proper hand washing before entering the unit. 6. In settings where hand washing facilities are inadequate or inaccessible, alcohol-based hand rubs can be used. 7. The hands should be dried with single-use autoclaved sterile towel or disposable paper towel. 8. Nails should be trimmed short and should be devoid of nail polish. Scrupulous hand washing before feeding or giving any nursing care to babies and napkin changing or bathing babies must be followed. In the newborn unit, D. Masks and sterile gown. Use them for all invasive procedures, e.g. lumbar puncture, blood exchange, transfusion, etc. Wearing of sterile gown after hand washing and prior to entering main unit is preferable. E. Sterile gloves. 1. Always use sterile gloves for all invasive procedures and for administration of parenteral medications. 2. Wash gloved hands to remove blood stains and secretions from the gloves and then discard them in a container of polar bleach. Wash hands again. 3. If gloves are being recycled, they should be cleaned, dried and packed for reautoclaving. Use disposable gloves if available. 4. If single-use disposable surgical gloves are reused, do not process them more than 3 times because invisible tears may occur. 5. Do not use gloves that are cracked or peeling or have visible holes or tears. F. Newborn equipment. Each baby in the unit should have separate kit containing day-to-day requirements such as thermometer, measuring tape, linen, etc., and these should not be swapped between the babies without proper disinfection. 4.7 Disinfectants, germicides used in newborn unit. 4.7.1 Types of various disinfectants, germicides used in newborn unit. 4.7.2 General instructions for using disinfectants in newborn unit. 1. Follow manufacturer's instructions. 2. Check expiry date before using. 3. Use recommended dilution. 4. Label containers date of issue and expiry. 5. Empty container after use. 6. Wash and disinfect container before reuse. 7. Do not refill container without disinfecting container between each use. 8. Topping up is not allowed. 9. Do not use the same container to store other solutions. 10. Do not leave disinfectant container open at any time. 11. Wash and clean articles before disinfecting. 4.7.3 Cleaning, disinfection, sterilization of newborn unit. Regular and thorough cleaning will decrease microorganisms on surfaces and help prevent infection. The environmental control program should include specific procedures for cleaning and disinfection or sterilization of patient care areas, equipment, and supplies. Nurse should ensure that these procedures are carried out correctly. While using bacillocid solution, the walls of the unit should be cleaned at least once daily. If bacillocid solution is not available, other disinfectants and soap water can be used. The floor should be mopped and cleaned with a wet cloth at least 1-2 times in each shift. The various disinfectants used for general housekeeping and various equipments, remember, times always discard disposable items after single use, times terminal disinfection is done after discharge or death of a baby, preferably all items of the baby e.g. blanket, measuring tape, stethoscope etc. should be put in a closed chamber, e.g. an incubator, not in use for baby care, and fumigated with 40% formalin. If it is possible, immerse all items except blanket and stethoscope in Corsolex or Sidex solution. Use 70% isopropyl alcohol or sterilium for stethoscopes. Every newborn unit should have a housekeeping schedule. The cleaning schedule should be displayed in a visible area having the details on exactly what needs to be done and how often should be provided. The following general guidelines for housekeeping should be followed. 1. Clean from the top to the bottom, e.g. of walls and window coverings, so that the dirt that falls during cleaning is removed. 2. Always wear heavy rubber or latex utility gloves. 3. Ensure that a fresh bucket containing disinfectant solution is available at all times. 4. Immediately clean up spills of blood or body fluids using disinfectant solutions. 5. Wrap or cover clean linen and store them in an enclosed cart or cabinet to prevent contamination with dust. 6. After each use, wipe off beds, tables and procedure trolleys using disinfectant solution. Fumigation. Fumigation of the unit should be carried out using EcoShield, silver nitrate, at least once a month. In case of a fatality, the unit should be fumigated as early as possible. A proper record of fumigation frequency should be maintained. In addition, a proper record of frequency of disinfection of various regularly used items should be maintained. Culture, sterile swabs for culture and sensitivity should be sent from floor, wall, baby, trolley and incubator. It should be sent weekly and before and after every round of fumigation. This helps to determine the flora of the unit and their sensitivity patterns. 4.8 Waste management. Proper management of hospital waste is important to keep the environment clean. To keep the environment clean, in each unit of ward, the waste should be disposed of in a proper way as per following biomedical guidelines which would maintain cleanliness of the environment. 1. Separate contaminated waste, e.g. items soiled by blood, pus and other body fluids from non-contaminated waste. 2. Use a puncture-proof container for contaminated sharps and dispose of the container when 2/3 full. 3. The following are different color drums with different color polythene for different type of waste to be disposed of in a different way. Black drums bags, leftover food, fruit feeds, vegetables, waste paper, packing material, empty box, bags etc. This waste is disposed of by routine municipal council committee. Machinery, yellow drums bags, infected biodegradable, non-plastic waste. Infected biodegradable waste consists of human anatomical waste, blood, body, fluids, placenta etc. This type of waste requires incineration. Blue drums bags, infected non-biodegradable, plastic waste. Infected non-biodegradable waste consists of used disposable syringes, needles. First destroy the needle in the needle destroyer, used sharps, blades and broken glass etc. Patient's forceps, BT set, ET tube, catheter, urine bag etc. should be cut into pieces and dropped in blue bag. This waste will be autoclaved to make it non-infectious. This is then shredded and disposed of. Guidelines for disposal of sharps. Procedure. Step 1. Put on disposable latex or vinyl gloves if available. Gloves will not prevent the wearer from being injured but will form a clean barrier between the hands and the syringe. Do not attempt to recap the needle. This is how most accidental needle stick injuries happen. The cap is usually bright orange and can be disposed of separately. Do not break, bend, or otherwise try to render the syringe useless. Step to bring your rigid walled, puncture resistant, sealable sharps container to the syringe. Take the sharps container to the syringe. Do not walk with the needle syringe. Step 3. Place the container on the ground or flat surface beside the syringe. Do not hold the sharps container or ask another person to hold it as you are disposing of the syringe. Step 4. Pick up the syringe by the middle of the barrel. The safest method of picking up a syringe is by hand. Staff can also choose to wear thin, disposable gloves that do not hinder dexterity. Do not crack the plastic barrel of the syringe or flick the syringe. Note: do not use a dustpan brush to sweep up the syringe, as the sweeping movement can cause the syringe to flick into the air and cause further risk. Plastic tweezers are not recommended as they may also cause the needle syringe to flick, commonly bright colored and found in many sharps disposal kits sold at pharmacies, etc. Step 5. Place the syringe in the container sharp end first. Keep the sharp end of the needle facing away from you at all times. Step 6. Securely place the lid on the container and ensure it is sealed. Hold the container from the top when carrying. Place the sealed container into your sharps disposal bin or contact your local council or health department regarding safe ways to dispose of your sharps container. Step 7. Remove gloves carefully so that no contaminated fluid on the glove comes into contact with your hand. Wash your hands with running water and soap. Other items that have come into contact with blood, i.e. gloves, should be disposed of in the same container as the used syringe or placed into double plastic container. 4.9 Post-exposure prophylaxis. Post-exposure prophylaxis, PEP, means taking antiretroviral medications as soon as possible after exposure to HIV, so that the exposure will not result in HIV infection. These medications are only available with a prescription. PEP should begin as soon as possible after exposure to HIV, but certainly within 72 hours. Treatment with 2 or 3 antiretrovirals should continue for 4 weeks. If tolerated, PEP has been standard procedure since 1996 for healthcare workers exposed to HIV. Workers start taking medications within a few hours of exposure. Usually, the exposure is from a needle stick. When a healthcare worker accidentally gets jabbed with a needle containing HIV-infected blood, the following actions are recommended immediately following any exposure to blood-body fluids, regardless of whether or not the source is known to pose a risk of infection for HIV, HBV, and/or HCV. Any additional facility-specific instructions for post-exposure management should also be followed. Free bleeding of puncture wounds should be encouraged. However, there is no documented evidence to support that squeezing the wound will further reduce the risk of transmission of blood-borne infection. The site of exposure, example, wound or non-intact skin, should be immediately washed well with soap and water but without scrubbing. Clothing contaminated by blood-body fluids should be removed. After mucosal surface exposure, the exposed mucous membranes should be flushed well with water. Eyes should be irrigated with water. Antiseptics, bleach and skin washes should not be used as there is no evidence of their efficacy and their effect on local defense mechanisms is unknown. Workers need to comply with occupational health and safety requirements in their workplace. The exposure incident must be reported immediately to the appropriate administrative personnel of the unit where the exposure occurred. The forms and requisitions that must be completed, as well as instructions as to how and where to report incidents, should be itemized or included in a directive, policy, or package. For potentially exposed workers, the exposure report should include the following details as well as any other information requested in an exposure report form. These exposure details should also be included in the healthcare worker's confidential medical file as per following details: I. Date, time and location of the exposure. 2. Job duty being performed at the time of exposure. 3. Details of exposure incident. E.G. Instruments used. Severity of exposure. Source. 4. Precautions taken while performing the job. Witnesses. 6. Factors that may have contributed to the exposure incident. 7. If exposed, was the health personnel previously vaccinated against HBV. 8. HBsAg and anti-HBs results from previous vaccination. 9. Action taken after exposure. KISS smiley results of initial and follow-up testing of source and exposed times the facility's occupational health unit or equivalent must be notified of the exposure incident. If this service is not immediately available, if possible, leave a message indicating the name of the exposed worker and source as well as a contact number for a return call. Times initial assessment of an exposure in a timely manner within 30 minutes of the event is necessary by an emergency room physician, an occupational medicine physician, an occupational health nurse or another healthcare professional educated in the assessment of exposure. Refer Fig 4.2 for management of blood-body fluid exposure. Refer Fig. 4.3 for determination of HIV status code. Basic regimen is recommended for HIV SC1 and extended regimen is recommended for SC2 described in Table 4.